Welcome back. COVID-19 isn't just taking a toll on our physical health. The quarantine also really affecting people's mental health as well. So we're here to talk about our mental health during this quarantine and the signs to look out for. We've got Shauna Reitmeyer, the Chief Executive Officer at Northwest Mental Health. Shauna, thanks so much for joining us. I just think this is such an important topic right now. So I'd love to hear from you, as I'm assuming you're talking to a lot of people about this. What kind of things are you hearing from families and kids out there, and how are they dealing with this?
Great question. I think each child and each family is different in how they respond, and it really depends on their situations. I think some are really good if they have really strong supports within their family and in their environment. But the families that are struggling with good coping skills, with maybe being on the front lines and having to be at work, juggling multiple children, or even homes that families have children with special needs. Those are the families that I think I'm the most conscious of, because I think they need extra support that they may have been getting in schools. And for some kids, schools were the only place where they really had that extra support, and that's gone. And so, we're really trying to encourage families to reach out to schools to get some of the supports that they need during this time. But boy, it's really different from one family to the other, but we are starting to see some of the kids that are starting to struggle. And it's those that we can't reach, that we may have been connected with before as well, that we're really trying to do some creative ways of trying to outreach with those kids.
Shauna, I had no idea you were going to talk about this morning, and then I happened to be on Twitter and saw a person put a post out about what's happening to our kids right now through this, and how that's not been a real prominent conversation. So to the parents out there that feel what you just said, what would you share with the parents? That, hey, here's some ways to deal with this.
Oh, goodness. You know what? Parents are being put in a position that they hadn't been before. And so you are not alone, number one. Your neighbor is probably experiencing very similar things. And you know what? It is very okay to reach out for help. Parents may be at breaking points of managing schedules, working at home, plus trying to figure out how to do math, how to organize a day when that hasn't been what they've experienced in the past. And so I really would encourage parents to reach out to the schools if they are needing some extra support or ideas, or if they're really struggling or concerned that their child is not adjusting very well, having a hard time concentrating, to maybe reach out to a mental health agency or provider and see if there's some support that can be provided, not only for the child, but for the parents as well, because this is a stressful time.
Boy, great feedback there. So with that being said, how do people reach out to you? And if they do, what kind of things can they expect from your organization?
You bet. So we provide a full array of services for children, families, adults, and we are doing so much through telemedicine right now. So parents don't have to leave their home, and they can reach out to us by calling our main number at 218-281-3940. Or they can also just reach out through our 24/7 crisis line. Now, you don't have to be in a crisis in order to call our number, and that's 1-800-282-5005.
Shauna, thank you so much. We appreciate it, and keep up the great work.
Thank you.
All right, stick around. We'll be wrapping things up right after this.